Since its outbreak in July, Uganda has seen a rise in the number of Mpox cases, with 104 infections reported so far. The majority of these cases have been centered around Nakasongola. Initially, the virus spread through border areas, but it has since found its way into local communities.
Numbers have continuously increased up to now 104 cases. They have now started clustering around in Nakasongola district in the fishing communities. So that makes us to know that there might be multiple levels of infections or coming in not only through the borders, but now the infection has started moving within the communities.
The demographics most vulnerable to this outbreak are the sexually active young men. 2 cases have already reached the school-going community.
They are young adult male who are most affected, and they are sexually active. And we've also now seen that it is in those who have HIV infection, because almost 25% of those new population are those under care. And those constitute the very vulnerable people who can get worse outcomes.
With its primary mode of transmission being sexual contact, the ministry says 7 districts are now grappling with an increase in Mpox infections.
The country and people need to know Mpox is not a myth, it is with us. The disease is currently spreading the whole of below the fishing community in Nakasongola. We've now also had 2 cases where it has gone into school-going population.
In the past 5 weeks, Nakasongola has recorded the majority of new cases, especially among fishing communities along the lake shores. According to the Minister of Health, Dr. Jane Ruth Cheng, this spike has been attributed to the lifestyle of these communities.
Fishing community, the cases have been doubling every day. And the driving force behind this is the fishing community and the kind of lifestyle that is in that area. It is also an area where we have a very high incidence of HIV. And the spread there is being fueled through sexual relationships. We are already down there